talk a little bit about how you've landed on Corepoint as your integration engine, maybe a little bit of the history or the story about how that came to be. That would be very helpful to kind of tell the story behind the scenes of fulfilling this role of focusing on the patient.
It's an interesting story from my perspective, mainly because when I started with UnityPoint, we had a different engine provider. We had regular downtimes, not planned downtimes, unplanned downtimes. And every time that happens, every time the interface engine goes down, we compare it really now to, imagine if Epic were down, which is the EMR system in use, right? It's as important as that, because that patient experience of walking into the front and then going back to the lab, that goes away if you don't have the interface engine up sending that data over. So we were regularly down with our old engine, and we were struggling.
It's about patient experience, it's about quality of care, it's about the speed at which you can deliver services, so that's convenience for both the care providers as well as the patient.
Absolutely, absolutely. Number one thing everybody should think about is, if I have to go to a UnityPoint Health facility, what experience would I want to have? And if we all go into our jobs thinking about that, then it'll make a much better experience for the patient, and the patient will want to come back. In IT, a lot of times you don't think about, how does it affect the patient, right? I'm working on a server, or I'm working on a computer. What does that have to do with the patient? Well, in the end, what you're doing, and specifically on the interface team, right, a lot of the things that get moved are patient orders or patient results. And the team at Corepoint did a really good job of working with us to say, okay, if you set it up like this, you can have some automatic failover, and you can have, a disaster recovery plan, and all of these other things that go with it. And wow, they tell you to set it up like that, it's going to work. It actually does. I know I shouldn't be surprised by that, because vendors say that all the time, but it's surprising that if you set it up like that, it works.